You will probably be exhilarated, excited, emotional, and probably exhausted. Your midwife and our whole team are here to help you and your baby at these crucial times after your baby is born. If for any reason your baby needs specialist care, we have highly experienced consultants and nurses in our neonatal unit. We will, of course, keep you informed of your baby's progress at all times. After weighing your baby and checking you and your baby are okay, we'll probably let you sleep for a bit. Most new mums stay in hospital between 6 to 24 hours to a few days after giving birth, depending on whether you had a vaginal birth or a caesarean section, or if there are other complications. This time is important so your baby can bond with you.
Just a way to help remember for effective feeding, we use the word chin, so C-H-I-N, and it will help you remember how to achieve a good latch. What you want, so the C stands for close, so you want, as you've got their baby nice and close to you, tucked in close to your body, so that's great. The H is for head, so you want the baby's head nice and free, but you're still supporting the head. Okay, so just like you've got there, so that's perfect, so she can still move her head away if she has to. The I is for in line, so exactly as you've got there, and as I'm showing here, the baby's in line. So you don't want the baby hanging down like that, nice in line. And then the last one is N. You want the baby's nose to your nipple, okay? And then when baby's nose is level with the nipple, you're looking for a nice big open mouth. As soon as she opens her mouth, you want to achieve the nice latch. That's when we know she's ready, when she opens her mouth nice and wide, bring the baby to you rather than you going down to the baby. So as you've got there, that's great. Once she's on, you'll see, I can see from here already, you've got a nice good feed and her jaw is moving, she's swallowing, you can sometimes even hear the swallowing sounds.
We'll help you get your baby used to breastfeeding if that is your choice, and tell you how to recognise if your baby is feeding well. It sometimes takes a little bit of effort to get babies feeding properly, but we will help you with that. When you're ready to be discharged from hospital and take your baby home, unless you gave birth at home, your midwife will inform you about postnatal appointments, plus days and dates when you can attend our postnatal clinic. We care about your mental well-being too. Becoming a mum is a time of heightened emotions. For most women, their emotions are mainly positive, but it's quite common to get what we call baby blues, and 85% of women experience this in the first few days after giving birth. Some new mums experience temporary feelings of unhappiness, loneliness, anxiety, or generally feeling low. A small percentage have a more serious feelings of depression and mood swings. If you already have a history of mental health problems, it's important for you to be in contact with services that you know. A postnatal review with your GP should help put this in place and provide you with the help you need. Whatever you feel, tell your midwife and we will be able to help. Finally, we're always keen to improve our services. If for any reason you're unhappy about the care you receive, please do tell us. If you've had a traumatic experience during labour or admission, we have professional midwifery advocates who are happy to speak with you and to do a debriefing whenever you are ready.